a realistic approach into a psychological assessment, I'd say that it's valued at some point where the therapist must gain access to the thought patterns and processes of the individual patient, and you must get some sort of idea of how the patient feels in general and how the patient feels normally on a regular basis. You really have to ask a whole lot of questions, and you can get some sense of what your patient's going through right in front of you with the way they react to your questions, of course. And the logical explanation for a diagnosis should come from, the idea of what your patient is actually going through, not only in life, but in their mind, in their brain. You have to really assess what's going on in the brain of this individual. So you have to know what's going on in their mind, how they feel, how they think, what their behavior is like, what their activities are, what they're doing with their time. What sort of things make them happy, what sort of things make them sad, what sort of things make them angry, what sort of things make them glad. This sort of approach is ideal when trying to establish how debilitating the illness is and how severe of an illness the patient may have, because if you're doing a general assessment to get a diagnosis of a patient, then it could help to have an institutional setting in mind, maybe to establish what the patient is like 24/7. So often when people make a diagnosis of a patient's disorder, they are institutionalized. The patient is institutionalized, and the therapist can get some idea of what the patient is like on a regular basis, 24 hours a day, 7 days a week. So that's how they get a handle on what's really going on with the patient. And another thing is that they have more than one person that's dealing with this patient to get a proper assessment, as easy as it is for anyone to see what is really troubling a patient. It helps to have a team anyway, just for proper assessments to be established by more than one doctor, more than one nurse, more than one staff member in mental health treatment. And it's all part of doing an assessment to find out what a person's disability or mental illness may be. So it's really some sort of mind bending action that allows a psychiatrist or a psychologist to make an assessment that brings up what a determination on somebody's uh, illness is.